back, and we thank you for staying with us on the program today. You know, having uncomfortable backs and certainly pain is something that unfortunately too many people deal with these days, but our next guest is somebody who's an expert in helping people to deal with that and come up with some good solutions to pain problems. Dr. Gerayli back with us today from Spinal Pain Specialists Medical Corporation. Welcome back, doctor.
Thank you for having me, Rob. Good morning.
Good to have you on the show today. So back pain, spine pain, something that a lot of people unfortunately do have. We've talked about some of the conservative treatments, hot and cold and over-the-counter medications, maybe even prescription medications. For some people, they get kind of beyond that point. It's still not being dealt with. You've got something you brought along today called a spinal cord stimulator. Can you tell us a bit about it?
Absolutely. As you mentioned, we have talked about a variety of treatment options, from very conservative treatments, including therapy and medications, to some injectables. But for some patients who fail all of the conservative treatments, and at some point even fail surgical treatments, we resort to some very high-tech interventions. And one of them, which we have talked about in the past, is spinal cord stimulation. One analogy I can use is if you cut your finger, for example, and you feel a very sharp pain, that sharp pain is transmitted through very specific nerves to your brain, and you perceive that sharpness. If at the same time you hold your finger and press very tight, that sharp pain goes away, and you feel the pressure from the pressure you're putting on there. Now, the reason that happens is because different nerve fibers transmit pain differently. And you can override the sensory input that goes through the spinal cord all the way to the brain by using a variety of stimulations. So spinal cord stimulation was invented to specifically deliver that. And as you can see in the spine model, the wires that are placed inside the spinal canal are able to, or enable us to deliver electrical impulses to the spinal cord similar to the pressure you exert on your finger that's been cut. And what that stimulation does, it overrides the sensory input from the painful stimulus. So the brain doesn't get the painful stimulus, it only gets that buzzing sensation that's coming from the electrical stimulation.
I see that the size of this is rather small. People who may have had heart conditions may have had a pacemaker installed. This is perhaps a little smaller or similar in size to a pacemaker.
It's very similar to a pacemaker. It's very thin. It's implanted under the skin, and it has 1 or 2 wires, depending on what we're trying to treat. And these wires are also under the skin, completely implanted.
Are there specific types of pain that respond better to this type of treatment?
Yes, there are. The types of pain that respond very well to spinal cord stimulation are what we call neuropathic types of pain. These types of pain are typically coming from nerve injuries. They're typically a burning type of pain. The kinds of pains that we see are from sometimes shingles-related pain, sometimes conditions called reflex sympathetic dystrophy, which is a nerve injury type of pain. But at the same time, a lot of patients who have had failed back surgeries. We work with the neurosurgeons who work with us and ask us to test the patients for this device, primarily when surgery has failed and they've had multiple back surgeries, and they continue to have not only back pain, but at the same time significant leg pain. So limb pain in general, whether it's in the arm or in the leg, responds very well.
Talk a bit about the procedure. Obviously, it's a surgical procedure.
It is a surgical procedure. The nice thing about this surgical procedure is that patients get to do a trial, a non-surgical trial, before they actually get the implant. And the way that is performed is that these wires are placed through a very fine needle inside the spinal canal, and nothing is implanted. Patient is sent home with an external generator that they can use for 5 to 7 days. Everything is just taped to the back, no incision is made, there are no sutures, and patients basically use the device, an external device, for about a period of 5 to 7 days to see if it really delivers what it promises. So at the end of the day, the patient is the one that determines whether this works or not. And if they feel that this has provided them with significant relief, their pain medication usage is substantially lower, then at that point they come back and tell us that they want to go forward with the implant.
Right, and it would be, of course, a surgical procedure, it'd be put under and incisions made and all that, and the device attached.
It's an outpatient procedure, typically done under local anesthesia, with perhaps a bit of sedation. Patients are generally not put under general anesthesia for this.
People appreciate that, I think, more and more these days. Maintenance on something like this, I know pacemakers need periodic battery things done to them. Is this going to be good for X number of years inside of somebody?
All these come with rechargeable batteries, and the battery, depending on the usage and depending on how much it's on, will last anywhere from 7 to 10 years, and at that point it's a very small surgical procedure to take the generator out and put a new one in.
Right, okay. I guess the big question for a lot of people is the insurance and Medicare aspects of something like this. Would they pay for something like this?
Yes, Medicare covers the trial and the implant, as do almost all other insurances. So it's never been an insurance problem at all. It's completely covered.
Sounds like it's something that could help somebody out if you think this might be helpful to you, or if you're just having pain in the back and you really haven't been able to solve it on your own. Give them a call over there at Spinal Pain Specialist Medical Corp and check it out, see what they can do for you, and you may end up with this rather high-tech device which has brought relief to lots of patients. So, Dr. Gerayli, thank you for coming by today.
Great, thank you for having me.
Good to have you on the show today. Again, that's a Spinal Pain Specialist Medical Corp. Give them a call and find out more about how they can help you to feel better. We'll be coming back right after this time out.